Thank you and welcome to this section, section 1, which is one of 4 sections that is looking at handling complex health and social care consultations. And this first section will be an introduction to the arrangements that we have in 3 areas in England. The second section will be talking about how to handle the heart sink feeling that doctors and health professionals get. The third section is going to be going into more detail about the arrangements at the 3 centres that are looking at complex consultations. And the fourth section will be a discussion between us about the ins and outs and tips and hints that are existing. So this is section 1, and it's an introduction to ourselves. I'm Mark Rickenbach. I'm a GP near Southampton and the clinical champion for continuity of care at the College of GPs. I'm also a professor of healthcare at Winchester University. I'm representing Kevin Haggerty and my colleague Julie Davidson at Peer Health, and they are in North Somerset. And the background is that they were involved in the Health Foundation programme from 2019 to 2021. And in that programme, we were looking at increasing continuity of care across sites in England. 500,000 patients, and we managed to increase continuity of care and show, or hopefully improve mortality and reduce emergency admissions. Now, we know that the literature shows that there is reduced mortality and emergency admissions. 15 years of continuity gives you something like 25% reduction in mortality, which is a pretty impressive figure. The problem is that when you see the same patient over time, you have to invest more time in them. And there's a transition period when you as a GP might feel a bit overwhelmed. Once you get through that transition period and know the patient, things run much more smoothly. So to help GPs and patients with that transition period, we set up a clinic which looks at high intensity users. These are people who come often to the surgery, and we've provided healthcare and social care support for them. You'll hear more about the next section. I'm going to pass on to Helen, who's going to tell you about what she's been doing in her practice.
Thank you, Mark. Hi, I'm Helen Marsden. I'm a GP in Manchester in Fallowfield. And our practice doesn't have this lovely opportunity that Mark's described. So for me in the practice, I'm the GP that sees a lot of the complex health needs patients. So it's an informal thing, really. They can gravitate towards me, but also I think the staff tend to fill my surgery with complex needs patients. So I have worked with complex needs patients for a long time, since being a GP from 1996 onwards. And it's my big area of expertise and also interest as well. I'm also a clinical lecturer at Manchester University, so it spills over into that a little bit because you see the students' needs as well, and it all feeds into that whole journey of a pet person in their life. So you start to see the complex needs in the students as well, which you'll see as a GP later on. So it's very interesting. And I'll hand over to Tim now.
Thanks, Helen. So aside from the breadth of experience of these two, I'm a reasonably newly qualified GP. I qualified in August 2020, so during the pandemic. But through my training, recognised that the area that seemed covered least by the textbooks and the training scheme was how to deal with these emotions that you get seeing the patients. And some of it's covered by the reflections in the portfolio, but often that's just a tick box exercise. And actually the real life of it's a bit different. It is reasonably thrilling. I've been reading recently about what the difference is between anxiety and excitement and how confidence can inflict you from one to the other. And that was part of what it made me realize that actually if I'm feeling the excitement with these heart sink feelings and heart sink patients, then maybe I could do a bit more with it. So we applied for a post-CCT fellowship from Health Education Northwest, and we were granted funding for 2 sessions a week for myself. So one full day to concentrate on improving the care of these heart sink patients who've been labelled like that traditionally, and as such have probably received unequal care. Lots of them received poor continuity because one doctor realized they couldn't help them. They went sought advice of another doctor, or one doctor said, could you go and see another doctor and perhaps they'll give you a better idea. You know, we've done all we can, and they're getting blood tests over and over again, and they're getting scans over and over again, and nothing ever gets any better. So I said to everyone at the practice, well, instead of you guys worrying about it, and to reception as well, because receptionists get the same heart sink feeling. If you get somebody on your list and you feel that feeling in your gut, then just say to them, well, look, Dr. Mercer is running a clinic for patients that we haven't quite been able to help, or anyone who we feel has been dissatisfied with the service or not getting all the care that they require, and we'll leave it to him to try and sort you out. So somewhere between the formality of the setup referral in process and Helen's more informal service of them just sort of gravitating towards it, I did suggest that they were directed to me. And then over the last year, with the fellowship funding ending in January 2022, over the last year we've been able to do a few things and look at how we can improve the heart sink feeling for the staff, reception, and also to try and get the patients feeling a bit better with the care they receive as well.
Great. So I think that's amazing, and all the work that Helen and Tim are doing. What we're going to do now is sign off this section, and we'll go on to section 2, which is going to talk about that heart sink feeling that Tim talked about. And then in section 3, if you want to leap to that, you'll hear more details about what we're doing in the various arrangements we've had to support people with complex health and social care needs. And in section 4, there'll be that discussion. So I'm going to wind off here. Thank you for listening, and we'll be back shortly.